changing lives.
And you are welcome to the consulting room. As you see us on your screen this Monday, we come on your screen and we bring you all the health information that you need to help you, your friends, your family, your loved ones. And we are very delighted that every week we come to your screens and we bring people that are well versed in all the topics that we are going to talk about. So today, I have my best friend in the studio with me. This is the first time in how many years since I started this show. It's been a disservice to her, but today I've brought her. You're welcome.
Thank you.
Please, what's your name?
My name is Dr. Latifa Tanko. I'm a medical officer. I currently work at the Iran clinic.
Okay. Me, I know. I just wanted you to tell the audience. So welcome and thank you for coming to our show, gracing our show. I hope you are going to learn a lot from you today.
Hopefully.
Okay, so we are going to learn about the liver. I just did a little learning session here myself. I learned that already I know the chi. The chi for liver is brebo, the ga is mlebo, and then the ewe, I think is jiklan. If I got it wrong, please pardon me. But we are going to learn something that has been worrying us so much, and yet we don't really know a lot about it because, unfortunately, a lot of people don't even know their status. We are going to go for our very first break. When we come back, we will just dive right into the topic, and you are going to enjoy it. Do well to stay with us.
5 doesn't always pause when your favorite program starts. Some days, there's still one more break to finish, but that doesn't mean you have to miss your favorite show. Download the Watts TV Plus app. It's simple, it's quick, it's free. Head to your app store, search Watts TV Plus, download, and you're in. Your favorite programs can move right with you. Different places, different lives, same feeling. Wherever life takes you, it's your TV, your time, your way. Feel free.
You're welcome back to the consulting room. We all have livers. Well, most of us. If you didn't have a liver, I don't think you would be watching me today. And we seem to forget that the liver is also one of the very essential organs that we have in our bodies. We have several parts, but the liver is just like every part of your body. It's working very hard. When you take something that is not too good, your liver would be able to help you, sort you out a bit. If it fails, then you are in trouble. But sometimes it's not just about the liver failing. It's about we ignoring a lot of things and putting ourselves at risk for a lot of things. So today, Dr. Latifa is here to tell us about hepatitis. Doc, please. We all hear about hepatitis, and I think one of the commonest things these other people talk about is Oba mema withdraw hepatitis, I will cure. Please, what is hepatitis? What does it mean?
So when we talk about hepatitis, we are basically talking about an inflammation or an infection of the liver. It can come from various sources. So we have some medications can cause an infection or an inflammation of the liver. Then we have our viruses. We have certain foods. So those are mainly the three common causes of, let's say, hepatitis.
Well, I've also heard some people say that when you drink alcohol, you can get some hepatitis.
Yes.
And sometimes some people will come to you and they said, I have some fat in my liver. Is that one to hepatitis?
Yeah. Yes, anything that worries the liver is called hepatitis, basically.
Okay,
I mean, an inflammation. So the fats in the liver, the alcohol, Yes, the medications, the viruses.
So you just mentioned some medications. Please, which medication? Because I don't want to go and take any medicine that will cause me any issue.
So when we are talking about medications, we do, so when you take the liver, we have some medications that the liver works on. Okay. Well, the commonest one, let's say, is paracetamol. So yes, excess or overdose in paracetamol intake, yes, can give us a liver issue. But usually that's in the setting of a liver that is already harmed or inflamed. Yes.
So me taking, if I have a headache and I take para, it's not going to cause
no, it won't cause that.
Any
it
hepatitis.
won't cause,
I don't want to.
It won't cause that. It won't cause that.
All right. So I think today we want to focus more on the viral hepatitis because fortunately for us, tomorrow happens to be the World Awareness Day for viral hepatitis, and I think they have specifically put that day there because we hear about it, but not a lot of us know about it. Can you tell us a bit more about the viral hepatitis? You are talking about viruses. What are they?
So
how do they affect the liver?
When we are talking about viral hepatitis, we have from hepatitis A all the way to hepatitis E.
Okay.
However, the ones which are of most concern is hepatitis B and C.
Okay.
However, let me touch on all of it, then we go deeper into B and C. Yeah. So with hepatitis A and E, it's usually gotten through food and water contamination.
Oh, you can get it from food?
Yes, food and water contamination. So it's through the fecal oral route. Okay. So
Doc, yeah, we don't like your big you people, you come
so
and then
basically
you giving us
we
big
mean if you don't practice safe hygiene,
okay,
you are eating from contaminated sources, you are drinking from contaminated sources, you're at risk of getting this hepatitis A and hepatitis E. However, the good news is it's self-limiting.
Okay. Please, what do you mean?
Meaning that if you drink enough water, you take enough good food, you get adequate rest, it will go away on its own.
So just like how they say a catarrh, you don't have a specific medication for catarrh. Okay, so well, it's not a good thing, but it's a bit better than
a bit of
the hepatitis you've been hearing about.
So it's self-limiting. That means that if you're able to take care of yourself, it will go away on its own. Yes. Just that sometimes hepatitis E can be fatal to the pregnant woman.
Oh.
Yes.
To the pregnant woman.
Yes.
That's quite sad.
Yeah, pregnancy is a bit of a pathological state on it. It's a bit of a risky state.
Yes.
So adding something like hepatitis E where a pregnant woman is going to be vomiting, having loose stools, being in a weak state, yes, can be a bit of an issue for them.
Okay, so we've spoken a bit about hepatitis A and E.
Yes.
Now let's talk about hepatitis B and C, since it looks like that is where a lot of the issue is with. What is hepatitis B, and how will you even get hepatitis B or hepatitis C? Okay,
so hepatitis B is it's a type of hepatitis infection. So we have it you can have it in acute. You have acute hepatitis and you have chronic hepatitis.
Okay.
Now, there are various ways of getting hepatitis. However, the most common way is the vertical transmission, which is mother to child. Okay, so
a mother having the virus
and then not being monitored, and then can transfer it to the child, who can also progressively get it when the child doesn't receive the hepatitis vaccine at birth.
Oh, okay.
Yes. However, before we continue, I want to state that with our vaccination schedule in Ghana, we do have hepatitis. It's part of our vaccination schedule.
The putting some drops in the baby's mouth and then giving the injection on the shoulder. It's part.
It's part of it.
Oh, then that's quite.
However,
nice
just for mothers who are hepatitis B positive, we encourage that. In fact, it's standard that the babies get the vaccine right within 24 hours of birth. And then some clinicians or some researchers actually encourage that the baby gets the immunoglobulin right away as well.
Okay, so hepatitis B, we are saying that the commonest way is that the mother through giving birth can introduce the child to it, and the child can also get affected.
Yes.
So is that the only way?
Oh, so there's the use of intimate items. So use of razor blades, contact with bodily fluids. But when I say contact with bodily fluids, I do not mean that through sexual intercourse. Surprisingly, sex transmission is one of the lowest ways to get.
But they've been
get hepatitis
saying
B.
it. If you sleep with somebody, ubenya hepatitis.
No.
So it's not. You shouldn't even be worrying about hepatitis. You should be worrying about something like HIV.
You should still be worried about it. Just that it's
not
low.
high
It's not high on the list. Yes.
Okay. So the hepatitis that we are talking about is the fact that they have a day to make the whole world know about it means that it is quite a big problem. Is it also a problem here in our country?
It is.
What are some? Do you have some numbers that?
So per the last paper I read, about 3 million Ghanaians have been diagnosed.
3 million.
Yes, and we are 24.
No, we are 33.
We are 33 now.
So it looks like 1 out of every 10 Ghanaian has.
Yes, those are the ones we've diagnosed.
Oh wow!
We don't know about the ones we've not diagnosed.
You take 10 people, one person has it.
That's the one person you are sure of. So with the other 9, you are not so sure.
You are not sure
that they
because
have.
they might probably not have been tested.
Yes.
Oh, that's scary.
Yes.
And how will I know that I even have this hepatitis?
Oh, so first line, you can go to any nearby clinic and be tested. However, most people are asymptomatic for a very long time. They are very, very symptomatic. They won't show any signs and symptoms of it because the thing about hepatitis B is, especially if it's an acute phase, it's self-limiting. Your body can fight it. And then your
body could fight that one too.
And then you could.
I thought it was just the A and then the E.
Oh no. Even with the chronic one, if you do all the right things, there are certain guidelines we want you to follow. If you're able to follow it, you will not really have any symptoms. You just live your normal and healthy life.
Okay, so hepatitis B, if I don't go and have my blood sample taken, I wouldn't be able. Someone cannot just look at my face and say, "Oh, hepatitis."
No, we can suspect it based on certain symptoms.
No, but
and signs
you
can present to the hospital.
When we are using the public transport, I don't know if you've encountered these people. They have medication for everything. They will tell you, Johnson, about 2 minutes or to it. If you pass urine and you are urinating for 2 minutes, I've heard someone say that in
a public transport.
VIP. Yes.
Okay.
Please, this is not a slander on VIP, but that was where I heard it. If you pee and then you are peeing for long, you should be careful that you might have hepatitis, which will now develop into gonorrhea and then.
Well, this is my first time. I've heard a lot of other ones, but not for hepatitis.
Please, which one did you hear? So that maybe if somebody has heard that one.
I think the most popular one I've heard, it has to do with the wormers and not necessarily hepatitis B.
Oh, okay.
Yes, they are like, if your child is not paying attention in school, it's because there's worms in your child's body. Yes.
Anyway.
It's just one of those things. Yes.
Anyway. So we've spoken a bit about hepatitis B and how to know it. What about hepatitis C? How will I know that I might have or I have hepatitis C?
Once again, we need to do a blood test. You need to come to the hospital. But
okay.
You can have some symptoms. There's the fatigue. There's the yellowing of the eyes. There's the yellowing of the palms as well.
It's not because the person is drinking too much alcohol, or that could also be.
Yes. Then there is the pale stools. Your stools no longer have the color they have. It looks like a white wall painted or a cream color wall painted.
I think our stool, in quotes, our toilet looks a bit yellowish, brownish.
Yes.
Yeah.
So if it loses the color and it's looking creamy to you, then you should know that no, this is not normal.
What about you said your eyes would be yellow, your palms would be yellow. What about the color of the urine?
So the urine most times will be like a Coca-Cola.
So dark.
Yes,
It
dark
would be-
color. Yes, I mean
Okay.
Coca-Cola Lipton like urine.
Okay, okay. So, if I have any of these, do I even have to wait till I have these before I come and get
You
tested?
don't have to wait. But you see, the thing is that with hepatitis B, there are two main differences between hepatitis B and hepatitis C. With hepatitis B, there's a vaccine. Okay, we need to understand that there's a vaccine. So if you come to the hospital and you get tested and you test negative, you can get the vaccine and you are protected for life. You get it?
Yeah.
And with the vaccine, it's a schedule. Once you test, you are negative, we give you the first shot. 1 month time, you come back for the second shot. And then in 3 months time, you come back for the last shot.
Okay.
After 10 years, you can do the titers and then you can get a booster. You get it? But with hepatitis C, there is no vaccination. However, if you do get hepatitis C, we can treat it.
I think now they said you can go to a lot of the big hospitals.
Yes.
And
So most of the teaching, all the teaching hospitals, then most of the regional hospitals and some selected district hospitals. I can only speak about regional hospital because I know there's a current hepatitis C program they are doing where if you test positive, you come there, they register you, then they give you the medication.
If I'm coming to Ridge, say I have hepatitis C, I've tested and I come to Ridge, is it expensive, the treatment?
I think the medications were for free, if I remember clearly.
Okay,
Yes.
then that's actually quite good.
But I don't know for now, so I can't speak about it. But this about a few years ago.
But it shouldn't be too expensive.
So they are treated using the direct acting antivirals. So I don't know how much they cost. I don't know how much it costs in the market.
I think there's this gastroenterologist on TikTok, I forgotten his Dr. Edu. He's been championing it, and recently I heard him make the statement that it is free.
Yes, okay.
It is free everywhere. And I actually referred somebody to Kolebu. I didn't even know that the person could go to Rich. And then he told me that all he did paid for was his hospital card to get the consultation. And then aside that, he didn't pay for anything else. Again. But then when they wanted to do the liver test, that one he had to pay. That one wasn't there. But then for the medication, it was absolutely free. Okay, so please, if you go and go and test and you are positive, kindly go, as she said, the teaching hospital. So the teaching hospitals are Kolebu Teaching Hospital, Cape Coast Teaching Hospital, Konfanoche Teaching Hospital, Tamale Teaching Hospital, Ho Teaching Hospital. Yes, I think those are the
major these are the
ones,
teaching hospitals.
And then the regional hospitals, that one, you know all your regional hospitals. Accra, our own is Ridge.
Greater Accra Regional Hospital, yes.
Okay, that's quite nice to know. What about the symptoms of the hepatitis C2? Is it the same as B, or is there something peculiar about hepatitis C?
So the thing about hepatitis C is that, as I said, most of them are asymptomatic. They do not present to the hospital any symptoms. And then some of our hepatitis C diagnoses are incidental diagnosis. We are looking for something else. We are like, okay, let's add hep C. We do it and it comes back positive. So most of them are asymptomatic. If you see someone, it's rare for you to just catch an isolated hep C unless the patient goes to the hospital for something else and then it's done. But as I said, they have general symptoms like fatigue, some pale color stools. They have the cola-like urine. Yes.
Okay, that's interesting to know. So I'm just seeing that aside the treatments being free, for hepatitis B and hepatitis C, the viral load is there's a bit of a discount from the sponsors that are giving the free treatment. They are giving about a 25 to 50% discount based on where you are having it done. Okay. So please, if you have any of them, just walk to any hospital. Don't wait for it to get to the stage where we can't do much about it. So I also read that hepatitis can lead to cancer.
Yes.
That is true.
It's true. So it can lead to what we call hepatocellular carcinoma, known as HCC. And this is mostly from hepatitis B, chronic hepatitis B.
Okay.
Okay, so we have people who present to us with chronic hepatitis B. So they come with all the symptoms. They have the weight loss, the yellowing of the eyes, the pale stools, the itchiness. Okay, and this is because the liver has undergone repeated inflammation, which has led to change of the liver surface and its body structure generally, and that leads to the cancer. So now it means the cells of the liver have changed and they've now become cancerous. It's one of the do I say fastest cancers, because most of the people I saw that had it didn't take long for them. It didn't. When
they were diagnosed, it didn't take long.
A long
time. For
I don't
them.
know if it's in our setting, but it really didn't take long for a lot of them.
Hepatocellular carcinoma is one of the worldwide. It's one of the leading causes of deaths, cancer-related deaths. And it's even worse here in our country, because most of us would wait till we are stage 4, and
it's spread everywhere.
It's very sad. Something that I don't think a hepatitis test is more than 200 cedis, even in the expensive places.
It should cost about 55 cedis.
It's for something that you can spend 55 cedis on. We wouldn't do it. Whether through negligence or
I don't think it's negligence. I just think it's lack of information. People do not know that they can just walk into a hospital and request for hepatitis B and C tests to be done for them, and they don't know that if I come and it's negative, I can be
given the
shot. So it's just lack of information.
But you see, with my little experience, when people come and they are negative, and then you advocate that they should go for the vaccination, they think you want to take money from them. That's been my experience. And I don't know how we can make people understand that the doctor suggesting something to you, it's not coming from the money points.
No, it's just coming from you protecting yourself. Yes. I have not had that experience, unfortunately. Fortunately for me, most of my patients, once I tell them you need to get the vaccine, they are willing and ready to get it. So I don't know, maybe it's the kind of patients I'm encountering.
Yes. I'm coming from a place where somebody paying 200 cedis for treatment, they have to call the whole family. So
there's a financial constraint aspect of it as well.
So unfortunately, a lot of us don't like going to the villages because of the constraints of practice. You can't do a lot for the patients.
You can't do a lot there.
Anyway, so we've mentioned the mother to child transmission. We've mentioned the sharing of the razor and then the sharp objects. We've mentioned exposure. What about exposure to someone's blood? That's probably maybe the person was using a needle and it pricked. Can that also?
Yes, it can. However, if you remember clearly, in most of our facilities, once you have a needle prick injury or a needle stick injury, the first thing is to go for the post exposure. So that significantly reduces your chances. But yes, a needle prick is one of the ways where you can contract hepatitis B.
So I don't know, Doc, if you've ever heard that when I was in primary school and we used to be running up and down, I ever heard someone say, "Don't touch me with your sweaty body. You will give me hepatitis." Please, is it true?
It's not true. It's a myth. It's not true.
So I can't get it from hugging?
No.
I can't get it from sitting in a trotro and then the woman has or the man has sweat on their arms and
unless you have an open sore, but then no.
Okay, and I can't get it from handshake?
No, you can't.
Doc, are you sure? Because they've been saying it.
All these are not true. They are myths. They don't exist.
And what about the one that they say they've bought the disease for me spiritually? You've not heard of that?
There's so many things to buy. So why are you buying disease for someone? No.
I can't get hepatitis through the spiritual world.
Not that I'm aware of. Maybe there's a new research we are not aware of, but no.
Because it's unfortunately it's some of the few things that people think they can get hepatitis from.
Yes, I've heard it before. I've had patients come to me diagnosed with hepatitis B, sometimes even retro. But then after talking to them and counseling them, they tell you that, oh, they've bought it for me, or this is a spiritual issue. So usually you see, sometimes you need to look around your environment and find a way to counter this this patient. So I'll tell you that yes, it's true. Not like it's true that they bought it for you. I'm like, okay, so do you know what we are going to do? Let me do my own and you also go and do your own. My own is to give you the medicine. Your own is to go to the prayer camp or wherever you think it is you want to go. Let's all do ours and then let's come together, because one hand alone cannot support this. And along the line, I mean, at the end of the day, if once I'm convinced you are taking the medicine, I have no issues. If you like go to all the prayer camps in the world, or all the traditional camps, or the Islamic houses in the world, as long as you're taking my medicines, I'm okay with it. That's one way to also like beat them at their own psychology.
Okay. I have never used that.
Oh.
I'll use
you
that.
should.
Okay, so you mentioned that chronic hepatitis B infection mostly could lead to the cancer.
Yes.
Does it mean that if I get tested for hepatitis B or C, and unfortunately I see positive, I'm going to die?
No. So this is how it works. When you test positive for hepatitis B, the next thing in line is that we do a hepatitis B profile for you. So the profile will let us know, is this an acute infection? Is this a chronic infection? Is it a chronic infection with replicating virus, or a chronic infection with non-replicating virus? So there are many interpretations to this. Okay. So once we get the profile, and then if it's an acute thing, we advise you drink lots of water, get lots of rest, eat fruits. Then we'll test you again another time. We will counsel you. If it's a chronic infection, okay, with replicating virus, we now start to do the other tests as well, the hepatitis C, the HIV, just to make sure that, just to find out where all of this is coming from, because it means that maybe you're in a state of, you're immunocompromised. Your body is not as fit as you think it is. And then if we have chronic hepatitis B with non-replicating virus, then it means that it's not replicating. That means the virus is not replicating. Your virus, they are not increasing in number. So after doing that, the next line is to do a viral load, especially for the chronic hepatitis B. Now, depending on where the viral load is, then we make a decision as well. Then we do the liver function test. For some people, if the viral load is in the millions, we, after doing the viral load, the liver function test, we do what we call AFP as well, an alpha fetoprotein, which is something that's produced by the liver. And then we do a liver ultrasound. So if the liver ultrasound comes back, the liver has changed or whatever, depending on the clinician's discretion, we can do a CT. So we can do a CT, a triple face.
The one that they put you inside the machine.
Yes.
Somebody once told me that thing is a coffin. You will never enter a CT machine. Anyway,
I mean, it can be scary. If you've ever been in one, you realize sometimes it's a bit scary. But I mean, apart from that, yeah. So there are lots of things we do before we can now come and say, hey, you are dying, But most of the times you don't tell you are dying. We do the best it is we can do for you. If it's just a chronic hepatitis with no replicating virus, your viral load is fine, your liver function is fine, your abdominal scan is fine. Most of the times we tell you eat well, drink lots of water, get adequate rest. But then there are some things we tell you to stay away from. We tell you to stay away from alcohol. We tell you to stay away from herbal medication. Good. It's very important, because the thing is that it's not as if we do not want you to take herbal medications. No, just that most of the herbal medications on the market, there's no proper research and proper R&D going into it. So we don't know what it contains. Okay, we cannot assure you of the quality of it. Okay, so we will just tell you, do not take it. So herbal medication, alcohol, excessive paracetamol, unfortunately, as I mentioned earlier, So yes, those are the things we tell you to stay away from, and then we also tell you to try and protect yourself as well. So those are it. So if you have a chronic Hep B, you can live a full life, a normal life, just that at least once or twice in a year we check your viral load, we check your LFT, and then we do an abdominal ultrasound just to make sure that you are within safe limits.
Okay, so if you're watching us either on TV or Facebook, or you're watching us on YouTube, you can send your questions to any of the comment sections and then they will be answered. But then if you're watching us on live TV, the number for the questions to be sent on is being displayed on the screen. So just send us a text, either a text message or a WhatsApp message, and then we'll be glad to answer all your questions, because I know a lot of us have questions. I just got a question. Someone is asking if we can get hepatitis B from kissing.
Not that I'm aware of. No.
So it's not.
The probability is very low.
It's very low.
Yes.
Okay. So please, you didn't add your name. Kindly just add your name so that, and where you are sending the question from, so that we can duly acknowledge you, and then you know that your question has been answered. So please, Mr. or Miss that sent that question, doctor says you cannot, not that you cannot, but then the probability of you getting it is very low, because come to think of it, even if unprotected sexual intercourse is quite low down there, then kissing will be a bit further down. Okay, so as you said, hugging cannot give you hepatitis, handshakes cannot give you hepatitis, sharing common household spoons, cups, forks will not give you hepatitis. Just go get tested, and if you are negative, get vaccinated. That's the message today,
yes.
Right? Okay, so we are going to go for our very next break. When we come back, doctor has been mentioning something about babies getting immunoglobulin. Her English today there is big. We are going to talk about how we can protect our pregnant women and then the babies that have hepatitis. And if you have any questions, as usual, don't be shy. Just send them. We'll answer all. There's no wrong question, and don't be shy. So do well to stay with us, and when we come back from the break, we'll continue the conversation on hepatitis.
Attention. I am a Simfuma Blessed Entertainment Prefect of PK Ejakun Adventist Preparatory School. I am here with my sisters,
Edna Oforidufe and Mariam Apiakeja.
PK Ejakun Adventist Preparatory School proudly celebrates its 10th anniversary on Thursday, 30th July 2026 at the school premises. Ahomaso, come and celebrate with us under the inspiring theme, 10 years of quality, holistic education and moral excellence.
And for 10 wonderful years, PK Ejakun Adventist Preparatory School has been nurturing young minds, building strong characters and producing future leaders for Ghana and beyond. This memorable occasion will be graced by the distinguished personalities including Mr. Ebenezer Mensah, the chairman, Lawyer Susanna Asamoah, the guest speaker, Elder Isaac Opoku, the special guest of honor.
There will be a lot of exciting activities, including cultural display, choreography, poetry recitals, drama performances, music, educational exhibition, awards presentation, games, and many surprises. We warmly invite all stakeholders, all students, parents, the Ahomasi community, and the general public to come. Let's celebrate this historic milestone with us. Come one, come all. Come, let us celebrate 10 years of excellence together. Don't miss it. Don't miss it. Don't miss it. Thank you. God bless you. Bye.
Life doesn't always pause when your favorite program starts. Some days, there's still one more break to finish, but that doesn't mean you have to miss your favorite show. Download the Watch TV Plus app. It's simple, it's quick, it's free. Head to your app store, search Watch TV Plus, download, and you're in. Your favorite programs can move right with you. Different places, different lives, same feeling. Wherever life takes you, it's your TV, your time, your way. Feel it free.
back to the consulting room. Today we are talking about viral hepatitis. If you missed the first half of the conversation that we've been having with Dr. Tanko, Dr. Latifa, my best friend, by the way, we've been talking about what hepatitis is. And if someone can tell me what it is, I'll send you toffee right now. So we know that hepatitis is basically inflammation of the liver. The different causes, alcohol, drugs, some diseases, yes, and a whole lot. And the viruses, we've spoken about hepatitis A and E being that we get it from food. So those of us that were exposed to the flood, let's go get ourselves checked. But I'm thinking that if you were exposed, since it is self-limiting, by now you should be okay. Fine. But just go get yourself checked. If you don't know your hepatitis B and C status, please and please again, the only way you can know whether you have it or not is to go to the hospital or to a lab and have a hepatitis B and C screening. And when you get tested and you are negative, Doc has spoken about vaccination. It's just 3 doses. Yes, injections are painful. Myself, if you come and see the way I've been dodging injection, especially the one that has to go into the muscle, it's painful, but it has to be done. Fortunately for me, I had mine done when I was starting medical school. That was some time ago. I did the booster and I'm fine. So I think we should all make it a point to do that. We are going to go back to Doc, and the pregnant women. It's quite sad that bringing life into the world comes with all this risk. Is there anything that is being done in Ghana for pregnant women to know their status? Is there something that is being done?
Yes, hepatitis B and C is actually part of the first, when you go for antenatal, what we call booking labs is part of the booking labs. Okay. So once you are seen and then you are diagnosed that you have hepatitis B, usually they refer you to see the gastroenterologist. They handle this hepatitis B issues. Yes. However, and then another thing is, once you are diagnosed as well, they counsel you, they reassure you, and then they prepare you to get the vaccine and also the immunoglobulin for baby, so that as soon as baby comes out.
It's expensive.
It is.
And it's not even, sometimes you might even have the money to get the immunoglobulin and then the vaccine for the baby, but you just cannot get it because it is out of stock.
Yes, that's one problem. That's one issue a lot of people are facing.
That's just
so
sad.
most times they start most of the mothers, in fact, mother and father actually are cancelled, and then they are told to start early, because if it's diagnosed at booking, depending on the time or the months, week during the pregnancy you presented to the facility. So if you presented early, that means you have quite some time to prepare to get the immunoglobulin. Some people also don't present early. Yeah. Then we have some that just pop out. They just come to the hospital just when they are in labor, and then that is when we find out that they have all of these.
And you know, it's very sad that the people that miss antenatal are the ones that when it's time for them to deliver, they come and we find out that they have all these issues with their pregnancy and their bodies. Yes. And it's very sad. Not just hepatitis, HIV, hepatitis, syphilis, everything is positive. Please, if you are pregnant, don't wait till 3 months. I'm waiting for the to wait. I'm waiting for the pregnancy to stay before I go and see a doctor. Please just go and see your midwife.
Once you test positive, you do the test at home. You test positive. Go to the hospital and get a proper diagnostic test done, and then an ultrasound, so that, because it's not only pregnancy. You know, sometimes pregnancy doesn't stay in the uterus. It can stick in your tubes, and that's another issue, a big emergency for you. So, just by the way, once you test positive at home, go to any nearby clinic, have a proper test, and then an ultrasound done, just to be safe.
So, Doc, is there any way? Yes, I think you've mentioned it though. But the immunoglobulin that you're talking about, how is it like? What is it? What essentially what is it going to do?
Oh, so it just helps to boost your protection. Okay, so
even in the babies, and it's safe for them.
Yes, it's safe for babies. So so let's take babies. We know that within to have B positive mothers, within 24 hours after baby is out, the booster shot is given. The vaccine is given.
Yeah.
And that should be enough, assuming the child will get all of their follow-up vaccinations. But sometimes, because we just cannot tell, a lot of the clinicians recommend that the immunoglobulin is given to booster to booster the baby's what do you call it, the baby's immunity. Now, for people that have had all their vaccine shots, like they've gotten all of the shots apart from the childhood ones, they've gotten the 1 month, 1 month starts 1 month, and then the 6 month dose. After about 10 years, they can go for the booster shot, which is an immunoglobulin. And for those people who have also had the shots, all shot, fully vaccinated, but then they get a needle prick in the line of, in our line of work, we usually do get these needle pricks. They are also recommended they get immunoglobulins.
Okay. And for the pregnant woman, they know their status. The antenatal care, does it become any different from them? For them, I mean, it doesn't.
It doesn't become any different.
So nobody will come and, unless they take your book, nobody will come and know that you have hepatitis B.
Nope, no one.
The midwives will not treat you as if you have some sores on your body.
They won't treat you any different.
They will not tell you that only you come on a weekend.
No.
If your colleagues are coming on the weekdays.
Nothing of that sort. There's no stigmatization with hepatitis B. None. You'll be treated normally.
Because I don't want to be pregnant and I come. Unfortunately, I come and hepatitis B is positive, and then they will come and be showing any attitude towards me that will make me not want to even come to the hospital.
If anything, we rather treat them with utmost care. You get it? Because being pregnant alone is very tiring, and then now hearing that you have something that you are not even aware of, or you don't even know where you got it from. So for them, if anything, we treat them specially. We make sure they are very, very comfortable. We consistently, and constantly reassure them.
And if I'm pregnant and I have hepatitis B, can I push my baby out through my vagina? I can do vaginal delivery.
You can do.
Hey, don't I have to do CS so that the baby will not get hepatitis B?
No, you do your vaginal delivery, and then baby comes, the baby gets the shots. That's all. Within 24 hours, whether CS or vaginal delivery, as long as your status is known, within 24 hours, baby has to get the shot.
What about breastfeeding? If I have, why would I want to breastfeed I don't want to give the child the child hepatitis.
Cannot get it as long as baby has been fully vaccinated at birth. Breastfeeding goes on as normal. There's so no
it will
change.
Not change anything.
It won't change anything.
You don't have to do tin food.
No
feeding.
Unless maybe you're not lactating.
What's the name of that thing? I've forgotten the name actually. The milk, the baby food. You don't have to do baby food.
Unless mother has a reason why she's not breastfeeding, like.
Oh, are you sure? I'll not give the virus to baby.
You won't. Not at all.
Doctor, we should take your word for it. Okay, so now we know that we have to come for antenatal and get our labs done, and then we can know if it's positive. You said they come and see the gastroenterologist.
Yes.
I was going to say gastroenteritis. Anyway, so the gastroenterologist would give. They also would the pregnant women also go through the same thing?
Yes. So they'll do most of the labs, but then the thing is that as you know, in pregnancy, sometimes your body behaves a bit differently. So sometimes you can have certain physiologic changes in your labs. However, that is why the gastroenterologist is the best person to see you, so that they work hand in hand with the obstetricians to deliver the best care to the patient. So they put their heads together and they make sure that, okay, whatever we are seeing, maybe it's due to hepatitis B or it's due to just the pregnancy changing things for the body.
And if I have a child, maybe I had hepatitis, I didn't know. I've watched today's show. I've gone to test. Then I'm prompted to test my child. We didn't really do the EPI well, the expanded program on immunization well, and my child also has hepatitis. What can be done for my child?
Oh, so since the child is still a growing child, we'll just counsel you, the mother, as we say, adequate rest, good food, good water, let the child live their normal life. The same process the adults go through will be done for the child as well. Once or twice in a year, depending on the child's status, child will have those routine labs done. Yeah.
Okay, so what do you think our religious leaders should be telling us about hepatitis B, just in case we have a pastor, an imam, a traditional healer, somebody watching? What do you want them to tell their followers or their members?
So they just need to tell them that, number one, hepatitis B is not a death sentence. The fact they have hepatitis B doesn't mean that's the end of the world for you. No. So that's one of the foremost things they need to tell their congregation or their people coming to them. They should also encourage them to go and get tested, and they can also work hand in hand with these health facilities and NGOs to bring the testing to the doorstep of the church, of the mosques, of the traditional healers.
On Friday, you have a lot of people at the mosques. On Saturday, Sunday, you have a lot of people
at the church.
Yeah, then they get tested. It's true.
And once they get tested and they are positive, I don't. You see, the thing is that it's up to the discretion of the person. I don't need to come and tell you that I tested positive for hepatitis B. You, the one testing me, you are not encouraged. In fact, you are under no way supposed to tell anyone else that I am hepatitis B. You get it? Because we do not want the stigmatization. You get it? So, apart from working hand in hand with these hospitals and NGOs to bring the testing to the doorstep and the vaccination. Okay, the thing about the vaccination, that it might be a bit dicey, because you know it's a paid for service.
Well, you see, I have a personal experience. My church, that's Cape Coast Central Church, SDA, Cape Coast Central SDA. The health department, almost every year, they organize hepatitis B vaccination for people.
Yes.
And they have a record. They note when you took the first shot, when you have to take the second one, and then most of the time people forget the third one.
Okay.
So they remind them. Yes. So I think it's feasible.
Yes, it's something we can pick up from the Cape Coast
Central
SDA Church. Yes, and then we can work hand in hand, and then we can even get philanthropists just buying the vaccine and then having it given to people for free. Okay. Yes. So
what would you tell caregivers, especially our teachers, the people in elderly homes? What would you tell them about? What should they know, and how should they treat people that are under their care?
Oh, just treat them like normal people. Just make sure that for kids, kids are in school, they run, they fall, they scratch themselves, they get hit. So apart from applying basic first aid from the parents, oh, this will happen to your child at school today. I think the way when you are going to university, they let you do a lot of medicals. I think it's one thing primary and GHS schools. I think now there are some schools that are doing, because
it's the private schools.
Yes, the private schools, of course. But I think for the government schools, it's something that can be done. Whenever kids are moving from kindergarten to class 1, it's a big deal everywhere in the world, actually. So I've forgotten what we call it, my first day at school now.
Yeah.
So yes, we can use that day to even do such a screening for the kids moving from kindergarten to class 1. And then if they, then we, because I'm sure they will come in smaller numbers, they don't come in larger numbers.
No.
So we can use that to screen them and then vaccinate them. So by the time they move to class 2, they are fully vaccinated. So imagine every year for kids moving from class 1 to class 2 gets fully vaccinated. It's a very good initiative, a very good way to do.
True.
And for our people in the elderly people, for us in Ghana, we don't have a lot of people in care homes.
Yeah.
Good. So I can't really touch a lot on, but I mean, if you have people in care homes, for most of them are, they test and screen them before they take them into the care home. For those that already even have it before coming, it's on their records that, oh, this person has this, that. So, I mean, they can be treated accordingly. But for those that don't have, I mean, the screening is very, very important, and the vaccination is important for us. And then for those that live with the elderly people at home, I mean, as we said, you can take them to any nearby facility, including yourself, and get tested as well.
Yeah. So the teachers should also test.
Yeah, the teachers have to test. It's very, very important. The teachers, the food handlers in the schools, the security, anyone that comes into contact with our children, anyone in the school, any worker should actually be screened and vaccinated. And
okay, so there are some NGOs. What would you tell them as well?
Oh, it is your money and your time we want. You come and help us screen our people, okay, and then you also help us pay for the vaccines. I mean, that will go a long way for us. And also with the public education as well. There's only so much public education a lot of health workers can do. So some of these NGOs, they also do a lot of public education, so they can also do that, encourage people, and then carry the message away.
Oh, okay, that's good. So we should know our status. We should get vaccinated or get treatment.
Yes.
We should, if we are getting treatment, we should do follow-ups, and we should just take good care of ourselves. And pregnant women, we should start early.
Antenatal very early.
We should get tested, get vaccinated, or get treated. And then we should also follow all the advice that both the
gastroenterologist and then the obstetrician.
I don't know why today I want to keep saying gastritis and
oh no,
gastroenteritis.
The gastroenterologist.
All right, okay. So what can you say a little bit about the stigma and then the discrimination? Because it's real.
So for most of the people I've encountered who have encountered this stigma, it's a lot of them who have hepatitis B, and most of them happen to be in the food industry. So once, you know, a lot of these big food companies, they do screening and screening, like frequent screening. So once they see that a worker has hepatitis B, they tend to let go of the person. So I've had patients come to me, tell me that, oh, there was a screening at work, they let them go on account of this, that. So now I have to now sit the patient down, explain to them that you cannot give someone hepatitis B through handling their food. No, it's impossible. Okay, so
unless you are literally cutting your hand
and putting that, still the probability is low. So once they understand that, we are able to, after educating them, we tell them to go back, and then you can actually take the company on, because you can sack me for a lot of reasons, but not for having hepatitis B. You get it? You cannot sack me for hepatitis B because I will not give it to you. The ways through which I can give to you is very low. So yes, if you have hepatitis B, you cannot give it to someone through handling their food, handling their clothes, no, not at all. You can't give it to them through that way. So please, let's stop stigmatizing against people we find with hepatitis B.
Okay, all right. So today we've had a very meaningful conversation. I'm really praying that the message goes a long way, because unfortunately, as you said, it is rather the negative messages that are going, and those people are in quotes cashing out on the ignorance of a lot of people, giving them concoctions and I don't want to use the word herbal medication.
Concoctions.
They are giving them concoctions, because we have legit herbal medication places. That's we have hospitals that actually even deal with herbal medication, and I've been an advocate for that. I don't mind if you are doing the herbal medication, but if you have to, you don't even know the dosage of what you are taking, then there's a question mark. So today we've learned a lot. I just want you to take a minute and drive the point home for us.
Hepatitis B and C is
Doc, just a second.
preventable.
Someone just sent us a question before you come to the conclusion.
Okay.
He says, my name is Mahama Adam from Kintampo. Hello, Mahama Adam. How many years duration if you have tested negative and have the vaccine? I think they want to know how long the vaccine lasts. The second question is also about someone talking about he or she taking the vaccine in 2010 and it's been 16 years now. So what should they do? They want to know.
So they can go and do the titers. We have what we call the titers to check your titer levels. Then after you do the titers, depending on where it is, you can just get them, globally, and you are good to go. And to Mahama from Kintampo as well. Usually they say it's lifelong, but after 10 years, it's recommended you get a booster.
Okay, all right. So please, Adam Mahama, you have the name of a good friend of mine, and the one that says he took it 16 years ago is Kwame from Kumasi.
Okay.
Yes. So we are glad that your questions are coming. Keep them coming, and Doc would answer all of them. So please, your conclusion.
So it's simple. Hepatitis B and C are preventable. Hepatitis B is preventable and hepatitis C is curable. With hepatitis B, all you need to do is to go to any health facility near you, get tested. If you are negative, you get fully vaccinated. Okay. If you are not, it's not the end of the world. You will still live your normal life as long as you go with the rules or the simple things we've told you to go along with. If you have hepatitis C, it's curable. We give you the medications and you are good to go.
All right. Thank you so much today for all the education you've given us about hepatitis. We hope that if we have questions after the show or we need some direction after the show, we will be able to reach out to you. Thank you so much, Doc. So
You're welcome.
Hepatitis B is not the end of the world. It's not a death sentence. The liver or your brebo or imlebo or I've forgotten the other one. Jika. Please, I hope I got it right. It's a very strong organ, but you have to protect it. Get tested, get vaccinated, go for the top-ups, get the boosters. If you're pregnant, talk to your midwife about it. Maybe they might have done it for you, but you didn't know. Check your antenatal records book. Get to know your health status. And if you have any questions, Consulting Room on Hope channel is always willing to help you out with reaching out to the experts like Dr. Tanko. And don't forget to watch us next week, Monday, and we'll be on your screen with another interesting conversation. Have a good night and have a good week.